Professor Paul Hunter, who's an epidemiologist and professor in medicine at the University of East Anglia, and he joins us now from Norwich. Welcome to the programme. Tell us, does an investigation into the origins of COVID also need G7 backing now?
Well, yeah, it's always difficult when politics and public health meet, but certainly we do need to know for certain, if we can, how this virus spread into human society, if only because then we can try and make sure it doesn't happen again in our lifetimes. The problem is that actually it's very difficult sometimes to prove exactly how the virus jumps, and I suspect we will never know for certain what exact mechanism was.
Why do you say that? Let me just jump in there, because that could cause a lot of alarm to people hearing this. Like, you think we may never know for certain the origins of COVID-19?
Yeah, because to do that, you need to I think it's now too late to identify the particular animal that most likely is the source of the outbreak, and a year later, you're not likely to have the same number of samples around. It's difficult to test people from that time because they may well have contracted COVID since then. So it can be very difficult and often impossible, even in outbreaks in this country prior to COVID. You don't always get to find out what the cause of the outbreak was, sadly.
So, Professor Paul, this is very concerning. You're saying it's too late. It's difficult to find the source a year later, and there you have US intelligence services and now the G7 wanting to find the origin. So, do they not think it's too late?
Well, if you can identify it and if you can investigate and come up with a plausible, then that is absolutely great, because then hopefully you can put in place controls that won't happen again. But I think most of us, we would really love to know how this spread into humans for certain. But I think most epidemiologists doubt that we will ever be absolutely certain. It doesn't mean to say that that's not impossible. We may well. It's not impossible that we could actually identify the exact time and nature of that transmission event. But as time passes, it gets more and more difficult to be confident that we will get to the bottom of it.
But if you've got the US intelligence officials working on this, surely we will get to the bottom of this.
You would hope so. I'm not 100% confident on that, and to a certain extent, the skills needed to investigate outbreaks are not necessarily the skills needed to work as spies and intelligence agencies. So hopefully they are working with the Centre for Disease Control on looking at plausible routes and how you might actually test that. But again, as time goes by, the information that's available, not only just within documented information, but information that's in people's bodies from their blood samples and things, antibodies tends to wane, and memories get poorer. So often you don't actually get to know for certain in these sorts of contexts. But it is still worth trying to identify it if we can.
Do you think the general public in the UK and other countries that you may be working with care at this stage, or do they just really just want to get their lives back to pre-COVID days? Oh, we remember those pre-COVID days.
Yeah, well, I think I don't think I can speak for the public. I can certainly speak for myself that I'm really looking forward to the time that we can actually put this whole thing behind us and we can get back to our normal lives, interacting with family and friends, traveling, and all the other things that we've missed out on this last 18 months. I think, having said that, I think many people would be interested in knowing how it actually got into humans, and if only because once we can prove that, if we can ever prove that, hopefully we can stop it happening again. But that is a big if.
Big if. Professor Paul Hunter, great to speak to you. Look forward to having you
pleasure.
on the News Hour here on TRT World again. Thank you.